Welcome to my channel. Today we are going to practice PHNP ANCC exam questions, domain 1, scientific foundation. I have first set of 20 questions that is on my channel that we did before. So if you have not seen those, you need to see them. A lot of students, a lot of people are finding it helpful. So if you are preparing for your ANCC exam, you need to see those set of questions. And today again we have another 10 sets that we are practicing still on this scientific foundation. If you have not followed me, what are you waiting for? Subscribe to my channel, follow me wherever you watch content, put on your notification button so that you will know when I drop the next set of questions or any other thing that can help you. Also, remember to repost, share, comment, like. If there is any topic that you want me to cover, let me know in the comment section and I will do that. Forward this to a lot of people that need it and invite people to subscribe. So we have here 10 questions. We have the options, the answers. We have detailed rationales and exam tips that will help you as you prepare for your exam. I wish you success, and we are going to be doing this together. So let's go. This is our question 1. It says, a 15-year-old high school student is brought in by her mother due to increased impulsive behavior over the past year. Teachers note she struggles to stay organized and act before thinking. No medical issues or substance use. Which brain region is still developing and most associated with these symptoms? What do you think? As you are reading this question, what are you thinking in your mind? What do you think? Let's look at our options. We have amygdala, we have prefrontal cortex, we have hippocampus, and we have cerebellum. And what do you think is the right answer? If you chose prefrontal cortex, you are correct. And this is because the prefrontal cortex regulates impulse control, planning, organization, and emotional regulation. It also functions that continues maturing into mid-20s. So adolescents naturally show impulsivity because this region is not fully developed. Remember, the region is the region that developed last. So at 20, it is still maturing. So that's why they are having they show impulsivity. The amygdala manages fear and emotions, but not planning. The hippocampus controls memory. Remember all this, not executive function. And the cerebellum coordinates movement, not behavior regulation. So you need to pick up all these important points because even the things that you see in this rationale will help you to answer some other questions when you see them. Let's look at your exam tip here. If teen impulsivity with no pathology, think prefrontal cortex immaturity. That is what causes their impulsivity. Let's go to the next question. A 67-year-old man reports tremor, slow movement, and rigidity worsening over a year. Cognition is intact, and labs are normal. He has difficulty initiating movement and demonstrates a shoveling gait. Which neurotransmitter deficiency is linked to this condition? What are you thinking? We have serotonin, we have dopamine, we have GABA, and we have acetylcholine. The answer is dopamine. Parkinson's symptoms occur due to dopamine deficiency in the neurotransmitter pathway. If you have not watched my video on neurotransmitters, you need to watch those. Serotonin affects mood. GABA is an inhibitory neurotransmitter, but it's not specific to this triad. Acetylcholine deficit is related to more cognitive disorders. So when you see somebody that is suffering from Parkinson's symptoms, is due to dopamine deficiency in neurotransmitter pathway. Remember that as you are treating the excess dopamine in the mesolimbic pathway, it is also reducing dopamine in other pathways. And one of the effects is that when this dopamine is reduced in the neurotransmitter pathway, we have Parkinsonian symptoms. All right. Okay, let's go to the next one. A 58-year-old woman reports forgetting recent conversations, but recalls childhood memories clearly. Neurologic exam is normal except for impaired recall of new information. Which structure forms new memories? This question is asking which structure of the brain forms new memory. Let's look at the option. Amygdala, prefrontal cortex, hippocampus, and thalamus. What do you think? We have the answer here, hippocampus. The hippocampus consolidates new short-term memories. The amygdala stores emotional memories. The prefrontal cortex manages planning, and the thalamus relays sensory signal, not memory consolidation. You need to pick up this important point. Okay? And look at the exam. It says new memory loss with intact long-term memory. You think about hippocampal dysfunction. Okay, hippocampus, hippocampus, hippo on campus. When we are in the campus, we need to remember a lot of things, right? A 32-year-old woman reports chronic anxiety, restlessness, muscle tension, and difficulty controlling worry. Vital signs show mild tachycardia, which neurotransmitter system is overreactive. We have dopamine, we have norepinephrine, we have acetylcholine, and we have GABA. If you watched my video on neurotransmitter, you can associate these neurotransmitters with one word. We have dopamine, reward, pleasure. We have norepinephrine, alert. We have acetylcholine, we have mood, and we have GABA, calm, right? We have not the answer is not epinephrine. The sympathetic nervous system and not epinephrine drive physical anxiety symptoms. Dopamine affects reward pathway. Acetylcholine regulates memory. Remember, acetylcholine regulates memory, and GABA deficiency causes anxiety because GABA is an inhibitory neurotransmitter that when you think about GABA, you think about calmness. So when GABA is in deficiency, it causes anxiety, not tachycardia. Norepinephrine, when you think about norepinephrine, you think about alertness. So when it's in excess, you think about anxiety. When somebody is too much alert, person will be everywhere, anxiety, anxious. So look at the exam tips. Anxiety plus body symptoms, that is norepinephrine excess there. A 29-year-old man has difficulty interpreting visual information after head trauma. He can see but cannot identify objects. Eye exam is normal. Which lobe is responsible? We have frontal lobe, temporal lobe, parietal lobe, and we have occipital lobe. What do you think? What comes to your mind? We have occipital lobe. The occipital lobe handles visual interpretation. Temporal processes sound, parietal integrates sensory input, and frontal manages executive functions. Frontal, they're always sitting in front, the executive managers, they're sitting in front. The occipital lobe handles the visual. So when you think about it, you can see, do you have your eyes at the back? All right, so can see but cannot interpret. Think of occipital injury, okay? A 70-year-old woman presents with gradual memory loss, word-finding difficulty, and impairment in daily functioning. Family reports she repeats questions and misplaces items. MRI shows cortical atrophy. Which neurotransmitter most reduced in this condition? Look at the symptoms. Gradual memory loss, word finding difficulty, impairment in daily function. We have dopamine, we have serotonin, we have acetylcholine, and we have glutamate. What do you think? This is acetylcholine inhibition. Alzheimer's diseases is strongly associated with acetylcholine deficiency. So remember also that acetylcholine, when you think about acetylcholine, you think about memory. Dopamine relates to motor disorders or pleasure. Serotonin affects moods. Glutamate contributes to excitotoxicity, toxicity, but it's not primarily early deficit. So acetylcholine is the major neurotransmitter that is implicated in Alzheimer's diseases. All right. Memory decline plus functional decline, you think about acetylcholine loss. A 44-year-old woman with schizophrenia reports hearing voices telling her to avoid leaving home. She struggles to distinguish internal thoughts from external reality. Which dopamine pathway is responsible for positive symptoms? If you have not watched my video on neurotransmitters, you need to watch them. It's going to help you to remember these neurotransmitters. Let's look at our option. Mesocortical, mesolimbic, nigrostriatal, and tuberoinfundibular pathway. What do you think? Mesolimbic. Positive symptoms such as hallucination and delusions, they are because of dopamine excess in the mesolimbic pathway. Remember, I mentioned earlier that when you are treating the dopamine excess in the mesolimbic pathway, you are also reducing dopamine in the nigrostriatal pathway, which causes the movement symptom. Okay, but this one, so that's by the way. So positive symptoms are from dopamine excess in the mesolimbic pathway. Mesocortical deficiency leads to negative symptoms. So when you are treating schizophrenia, when you are treating when you give antipsychotic, it affects dopamine in all pathways because you are trying to reduce dopamine in the mesolimbic pathway just to treat the positive symptoms. It will also be reducing dopamine in other pathways. So when it reduces in the mesocortical pathway, it leads to negative symptoms, right? And when it is reduced to in nigrostriatal pathways, it causes EPS. And when it reduces in tuberoinfundibular pathway, it causes prolactin elevation. So remember all these things. Remember when there is dopamine deficiency in different pathways, what are the effects or the disorders that is associated with this? If you have not watched my video on neurotransmitters, go to my page, RoyalPearlz Health and Wellness. You will see those videos there. It's so helpful. It's going to help you to remember a lot of things. Let's look at our exam tips. Hallucination is mesolimbic dopamine excess. That is the cause. When there is too much dopamine in the mesolimbic pathway, it causes positive symptoms. A 50-year-old man taking antipsychotic developed stiffness, shoveling gait, and tremors. He denies fever or muscle rigidity. Which pathway is affected? We have mesolimbic, we have mesocortical, we have nigrostriatal, and we have tuberoinfundibular pathway. Which pathway do you think? We just finished this nigrostriatal pathway. Okay. Extrapyramidal symptoms, the EPS, is as a result of dopamine blockade in the nigrostriatal pathway. This is classic for first-generational antipsychotics, but it can also occur with stronger second-generation agents, antipsychotics. So bear that in mind, even though we say sometimes it's less, but it can also occur with the strong ones. EPS, nigrostriatal blockade, remember that. A patient on risperidone reports breast discharge, decreased libido, and menstrual irregularities. Which pathway is responsible for this effect? Let's look at our options. We have mesocortical, mesolimbic, nigrostriatal, tuberoinfundibular. These are classic questions that you may see on your ANCC because they want to know that you know the pathophysiology of some of your disorders or the effect of the medication that you are giving. So you need to know this. They want to know that you know the impact of these on all the pathways. And the answer is tuberoinfundibular pathway. Remember, when there is dopamine deficiency in the tuberoinfundibular pathway, it causes the breast discharge, high prolactin. Dopamine normally inhibits prolactin. Blockade in the tuberoinfundibular pathway increases prolactin, causing galactorrhea and sexual dysfunction. You have to know this. So when dopamine blocked this pathway, you have excess prolactin, causing galactorrhea and sexual dysfunction. These are very important points that you need to remember for your exam. So galactorrhea on antipsychotics, tuberoinfundibular pathway. Remember, don't forget this. The last question says, a 22-year-old woman with major depressive disorder reports poor sleep, low mood, reduced appetite, and anhedonia. She denies substance use. Which neurotransmitter is most associated with mood regulation? You see, you have to pay attention and also understand what your question is answering and is asking you. You know, when you start reading this, you might be thinking about something else, but look at the question. Which neurotransmitter is most associated with mood regulation? So let's look at the options. Dopamine, we have serotonin, we have GABA, and we have glutamate. What do you think is the neurotransmitter that is associated with mood? Serotonin. Serotonin plays a key role in mood, appetite, sleep regulation, dopamine, and dopamine regulates reward and motivation. GABA is an inhibitory neurotransmitter, and glutamate is an excitatory neurotransmitter. Don't forget this is an important point that you need to remember for your exam. Look at our tip here. When you have when they ask you which neurotransmitter is implicated in depression, remember serotonin dysregulation, because when you have low serotonin, you have depression. So serotonin is highly implicated in mood disorders such as depression. So you need to remember this. And here comes the end of this batch of questions. This is 10 questions that we did today. Another batch is coming soon. And we also have a 20 question. We have some other questions that we posted. Do well and visit our channel. Remember to subscribe, repost, share, comment, like. If there is any particular thing that you want me to discuss, put it in the comment section and I will see it, and I will see you in my next video. Thank you.